Type 2 diabetes is a medical condition that frequently develops in people who have become overweight or obese. Before people develop type 2 diabetes, they usually have prediabetes, a condition where blood sugar is slightly elevated but not enough to be classified as diabetes. A person with type 2 diabetes has difficulty using sugars from food to fuel vital bodily functions. As a result, blood sugar levels rise and body cells become starved of energy. All cells in our bodies require a supply of the sugar called glucose for energy. For glucose to move from the blood into cells, a hormone called insulin is needed. Insulin is produced by the pancreas in response to an increase in blood sugar levels after we eat. In type 2 diabetes, your cells don't use insulin properly. This is called insulin resistance. Your pancreas will try to make more insulin to overcome the resistance, but over time, it becomes more difficult for it to produce enough to keep your blood glucose levels normal. Elevated blood sugar will eventually damage other organs in your body and will increase your risk for heart and blood vessel disease, kidney damage, nerve damage, eye damage, foot damage, skin and mouth problems, osteoporosis, Alzheimer's disease, and hearing problems. Prediabetes usually does not have any symptoms and is diagnosed with blood tests. But if your type 2 diabetes has advanced, recognizing the symptoms and seeking early treatment is very important. Common symptoms of type 2 diabetes are urinating frequently, feeling thirsty all the time, feeling hungry even when you just ate, feeling extremely tired and fatigued, experiencing blurry vision. Treatment plans for type 2 diabetes vary between individuals, but you will most likely have to monitor your blood sugar regularly to ensure it is within healthy limits. It is also likely that you will have to adjust your diet and increase your physical activity. If you are overweight or obese, reducing your weight by even a few pounds will help you maintain better blood sugar control and reduce your risk for diabetes-related complications.
The typical patient on our HCG program loses about 20 to 30 pounds in a 6-week period. There's an average of a half a pound to a pound a day. Some less, some more, but our average is somewhere around 25 pounds. And then after that, we transition them into a very healthy maintenance program. The diabetics that we have put on this, it has significantly helped their diabetes, and a lot of times they need less medication. We actually take their medication down by 50% when we put them on it off the bat. But when they go back and they're off of it, it seems to improve their diabetic control, maybe because it changes how they are relating to food.
While diet, increased activity, and weight control may be all that you need to control your diabetes, if it is not, your doctor will prescribe oral medication or insulin to help you maintain healthy blood sugar levels. A diagnosis of prediabetes or type 2 diabetes is serious. The good news is that with appropriate lifestyle changes and perhaps some medications, diabetes is manageable, and with a little help, you can delay or prevent complications.